Imagine this. The condom breaks and your stomach drops. Suddenly, your mind is racing. Do I need plan B? Could I have gotten HIV? Should I get tested right now? Here's what most people don't realize. If HIV exposure is possible, there is a critical 72-hour window to act. You miss it and some of your options disappear. I'm Dr. Mallad, an infectious disease physician. And in the next few minutes, I will show you exactly what to do after a condom breaks using a simple 4-step rescue plan. Remember it as 4P: partner, pregnancy, PEP, and a plan for testing. If you can remember these 4 things, you will know exactly what to do instead of panicking. Have you ever wondered why a condom break feels so terrifying? The moment a condom breaks, a moment of joy turns into regret, and most people think they have medical problem. But first, they actually have an uncertainty problem. 5 minutes ago, you felt protected, and now you don't. And uncertainty creates fear. I have seen people lose sleep. Some people develop nausea, stomach pain, racing thoughts within hours. I have had patients convince themselves they were infected before any test was even possible. The reality, a broken condom does not automatically mean you got an STD. And understanding that distinction is incredibly important because the goal isn't panic. The goal is making good decisions over the next few hours. But what does a condom break actually mean? Condoms are one of the best tools we have to reduce the risk of pregnancy and many sexually transmitted infections. When used correctly, condoms work very well, but they are not perfect. Large studies show condom break or slip off approximately 1 to 2 times out of every 100 uses. Most of the time, nothing goes wrong. But when a condom tears, slips off, or stays behind inside the vagina or anus, the protective barrier is no longer doing its job. Think about wearing a raincoat during a storm. If the raincoat stays intact, you are protected. If it suddenly rips open, water can get through. A condom is very similar. The barrier fails, body fluid can mix, and now we have to assess risk. Now here's the question everyone wants answered. How much danger am I actually in? The answer depends almost entirely on one thing, and it's not the condom, it's the partner. It's the first P of the 4P rescue plan. P for partner. The first thing I want you to think about is your partner, because the condom itself is not the source of infection. The partner is. If your partner doesn't have HIV, a broken condom cannot magically create HIV. If your partner doesn't have gonorrhea, the broken condom cannot create gonorrhea. The condom failure only matters if an infection is present in the first place. So ask yourself, do I know my partner's HIV status? Have they been tested recently? Do they have any known sexually transmitted infections? Are they taking HIV treatment if they are HIV positive? Are they taking PrEP? I know these conversations can feel uncomfortable. But uncomfortable conversations are better than uninformed decisions. The more information you have, the better decisions you can make over the next few hours. Now let's look at what researchers found when they studied people whose condoms actually failed. Research led by Dr. Grimley studied patients attending an STD clinic. These researchers wanted to understand how often condom problems occurred and whether those problems were associated with sexually transmitted infections. Patients were asked questions such as, has a condom ever broken? Has it slipped off? Have you experienced problems using condoms? The researchers then tested participants for gonorrhea and chlamydia, and the findings were eye-opening. Nearly 1 out of 4 participants reported some type of condom problem. More than 15% of people in the clinic tested positive for gonorrhea or chlamydia. And among men, those reporting condom breakage were almost twice as likely to have gonorrhea compared with men who did not report condom breakage. This does not mean a broken condom automatically gives you an STD, but it does tell us something important. Condom failure can be a warning sign. It tells us that protection was lost, fluids may have been mixed, and if an infection was present, the opportunity for transmission increased. That's why healthcare providers take condom breakage seriously. Not because we want you to panic, but because we want you to act appropriately. Now, next P is pregnancy. If pregnancy is possible and semen entered the vagina, emergency contraception may need to be considered. Many people make a mistake here. They wait. But emergency contraception works best the sooner it is taken. The goal is not to end a pregnancy or abortion. The goal is to prevent a pregnancy from starting. The sooner you act, the better. Hence, if pregnancy is a concern, don't wait several days before making a decision. But for most people watching this video, there is one concern that creates more fear than everything else combined: HIV. And this is where the clock starts ticking. Third P is PEP, that is PEP. If HIV exposure is possible, there is something called PEP. PEP stands for post-exposure prophylaxis. Let's simplify that. Post means after, exposure means contact, such as any sexual activity. Prophylaxis means prevention. The goal is to stop HIV from becoming permanently established in the body. And here's the most important number in this entire video: 72 hours, the 3 days. PEP must be started within 72 hours of the exposure. Think about a house fire. You don't wait 3 days before calling firefighters. You act immediately. The earlier it starts, the better it works. If the partner may have HIV, if their status is unknown, or if you are concerned about the possibility of HIV exposure, seek medical attention immediately. An emergency room, urgent care, a sexual health clinic, a healthcare professional familiar with HIV prevention can help. Don't let embarrassment cost you an opportunity. I have had patients tell me, I almost didn't come in because I thought I was overreacting. My response is always the same. I would much rather evaluate someone who doesn't need PEP than miss the opportunity for someone who does. Now, fourth P, plan for testing. After you have addressed partner, pregnancy, and PEP, now it's time to make a testing plan. And this is another area where people make mistakes. Many people rush to get tested the very next morning. The problem? Some infections simply aren't detectable immediately. Testing too soon can provide false reassurance. Depending on the exposure, testing may include Chlamydia, Gonorrhea, Syphilis, HIV, Trichomoniasis, Hepatitis B, and sometimes Hepatitis C. Some tests can be performed relatively early, and others require follow-up testing few weeks later. That's why having a testing plan matters more than simply getting tested immediately. Remember, no symptoms does not mean no infection. Many sexually transmitted infections cause little or no symptoms earlier. Oh wait, what about herpes and HPV? These infections are slightly different. They often spread through skin-to-skin contact rather than body fluids alone. Condoms reduce risk but do not eliminate the risk because condoms don't cover all skin surfaces. The good news? HPV vaccination can dramatically reduce risk from most dangerous HPV types. And herpes can be managed with effective medications that reduce symptoms and lower transmission risk. You can watch my previous videos on herpes. Final takeaway. If a condom breaks, don't panic. Remember the 4P rescue plan: partner, pregnancy, PEP, plan for testing. Those 4 steps can guide almost every decision you need to make. Most people who experience a condom break will not develop HIV. Many will never develop any STD at all. But the people who do best are the ones who act early. So if you remember only one thing from this video, remember this: fear is not a plan. The 4P rescue plan is. And if HIV exposure is a possibility, every hour matters. Don't wait. Also, don't wait to subscribe my channel.